panel, not because we don't love you, it's just it worked out that way. Chair calls up Todd Citron and Veronica Sanchez. What happened? Okay.
Service with a smile.
There we go. Check it out.
First of all, thank you guys. Truthfully, I know it's been a long day. I knew it was, and I think I told you it was going to be midnight, maybe. So, but y'all are important.
Thank you.
And when Chairman King, were talking a little bit, first responders were actually what came to my mind, because kind of the things they're seeing and doing. And then I think I forgot who. Somebody gave me y'all's name, a friend of mine. And somebody said it's 5,000 encounters, one of your groups or something. But just go ahead and tell us your story. Tell us your name, tell us your story.
Sure. My name is Todd Citron. I'm the Chief Executive Officer for Hill Country Mental Health and Developmental Disabilities. Chairs Perry and King, members of the committees, thank you for the opportunity to speak with you today. Thank you for coming to Kerrville. Again, I'm the CEO of Hill Country Mental Health and Developmental Disability Centers, which provides mental health crisis response and a range of community-based services for individuals and families across Kirk County and the surrounding region. As the local mental health and IDD authority for a 19-county service area, we are responsible for local disaster behavioral health response when an event results in a disaster declaration by local officials, the governor, and or the President of the United States. As the local mental health authority, our role during an emergency crisis response is to work in collaboration with local agencies and the Texas Health and Human Services Commission to support the emotional and psychological needs of survivors and others impacted by the disaster, both in the immediate aftermath and throughout the ongoing longer-term recovery. Along with the Disaster Behavioral Health Coordination Division of HHSC, the local mental health authorities have a long-standing identified role in the Texas Emergency Management Plan. The local mental health authorities in the disaster area work in collaboration with each other and HHSC's Disaster Behavioral Health team to put those services on the ground and address the emotional support needs of the citizens throughout the area. Today I'm here to share our experience in the field and in partnership with Veronica Sanchez, who's the Executive Director of Camino Real, which is another local mental health authority. We offer some suggestions. I also want to acknowledge the resilience of our community and the extraordinary collaboration we have with the Health and Human Services Commission, local officials, the Texas Child Mental Health Consortium through their TCHAT network, and my colleagues across the state who continue to deploy teams to support our response effort. At present, 5 other LMHAs, Bluebonnet Trails, Camino Real, Center for Healthcare Services, Integral Care, and Tropical Texas have already deployed teams or are scheduled to deploy teams on a rotating schedule to our local service area. In addition, a 24/7 Texas flooding emotional support line that is available statewide is operated by the Harris Center, which is another LMHA. On a personal note, I have been the CEO of Hill Country MHDD for approximately 4 years, and we have now responded to 2 mass casualty events, Uvalde and this major flood. I can tell you how much I appreciate the Hill Country staff and the ready response of HHSC, my LMHA colleagues across the state, and other partners, including the Texas legislature, to ensure we can be there for our community in these tragic circumstances. And as you know, a disaster can happen anywhere at any time, whether it's a man-made tragedy or a natural disaster. I want to mention briefly, just in regards to preparedness in regards to our response activities, and they go back to 2015. We formally established a disaster response team structure. This occurred in the aftermath of the devastating floods in Wimberley, where over 350 homes were destroyed and 12 individuals lost their lives. At that time, a staff member of ours, Randy Consford, created a rapid support deployment system based upon the FEMA Incident Command System. Fast forward to today, Randy continues to operate as our lead incident commander, and we utilize the immediate deployment incident command structure. Mr. Consford assumed that role in the aftermath of the Uvalde tragedy and presently leads the Kerr response effort. Our response is based on crisis counselors who deploy throughout the community 7 days a week to assist impacted individuals. These staff are licensed mental health clinicians, qualified mental health professionals, counselors, care navigators, peer specialists who've been trained in psychological first aid and trauma-informed care. In regards to our actions as the LMHA in disaster response on July 4th, Mr. Consford established the Incident Command based out of Kerrville Administration Office, located exactly 3 miles from here. He reached out to our internal staff who would make up the initial deployment teams who would cover rotational shifts over a 7-day per week basis. Immediately, we deployed team members to the Reunification Center located at Ingram Middle School to support children being reconnected with their families, many children who had been brought by helicopter from Camp Mystic. Staff were also deployed to Trinity Church and Grimes Funeral Home to support family members who were having to identify the bodies of their loved ones. We have provided embedded behavioral supports at the Family Assistance Center and the Disaster Recovery Centers that are operated in partnership with TDM, local law enforcement folks, and FEMA representatives. We have supported the camps located at Hunt and Centerpoint and routinely round local neighborhoods, businesses, shelters, schools, churches, and local gathering sites using a community canvassing approach. We even borrowed ATVs to get to difficult-to-reach riverbed areas to support volunteers and first responders wearing boots that were snake bite resistant. We deployed 2 recently purchased mobile mental health clinic vehicles to the community that have been mainly situated in Hunt Centerpoint, and those are in the handouts I gave you. There's pictures of those. A total of 50 fellow LMHA staff from the 5 previously mentioned centers have been either on site with us or will be joining us over the next couple of weeks. The sister LMHAs are providing coverage over 7-day periods and deploying with us to the community wearing these green emotional support vests. These have been wonderful as folks recognize that the many folks who they see usually on a daily basis, around 30, who cover about a 30-mile swath of land between Hunt and Centerpoint, wearing these vests, that they are there to support them in regards to the emotional response they're having to the tragedy. To date, we have deployed over 30 of our staff to the community to provide emotional supports. And these were people who were working full-time in other jobs, who they came to the point as a manifestation of the deployment and left where they were working in our other 19 county locations as part of the Incident Command deployment. 2 weeks ago, we opened an emotional support center that is available 7 days per week to walk-ins that is in downtown Kerrville to assist as a central hub for grief support, stress management, and brief counseling. To date, we have provided emotional support, psychological first aid, and resource referrals and counseling to 6,919 individuals throughout Kirk County, or about 270 people per day since July 1st, mostly along the Guadalupe River corridor, a roughly 30-mile stretch, and to some of our neighboring counties. Many of the individuals have experienced direct loss, displacement, and trauma. And in addition, we are scheduling numerous mental health first aid trainings with various ISDs throughout the area as schools get ready to open in a couple weeks. I want to mention a couple of kind of specific cases. So again, we have had contact with close to 7,000 people. These mental health vans that I had mentioned, and there's pictures of them in the handouts I gave you, we deployed them to Hunt and to Centerville, and we use those. They have telemedicine capacity, but we've also used them for kind of like satellite mobile clinics, and we have counseled hundreds of people in those mobile vehicles. We have We have worked with camp counselors who have been in distress as a manifestation of what they've experienced, and they request the people in the green vests. We have met with numerous family members and property owners who've identified deceased people and counseled them through that. And we have worked with numerous also emergency responders and who some are still counseling to this day. Some choose to get counseling through their resources, and some have chosen to seek services, care through us. So at this point, I'm going to turn over to Veronica.
Good evening, and thank you for permitting me to testify today. I'm Veronica Sanchez. I've been the Executive Director for Camino Real Community Services for the past 4 years. As Todd mentioned, each local mental health authority is responsible for disaster behavioral health services. We do this as part of our Health and Human Services contract. So each of us does have to have a component built in with the ability to respond after a disaster. Camino Real, in preparation for this responsibility, has already established or pre-identified individuals, staff on our that are part of our employee base, has an identified team. We have up to 15 people that we're able to deploy at any given time because, as many have mentioned, you do not know when a disaster is going to hit. We try to pick individuals who are experienced in a variety of areas to include children's mental health, substance use disorders, intellectual and developmental disabilities, able to work with persons with autism. So we try to get a diverse group. We have licensed professional counselors, licensed clinical social workers that are available. They're part of our team. And then, of course, we have qualified mental health professionals. These individuals are customarily part of our mobile crisis outreach team services. They are accustomed to responding to psychiatric crisis. Disasters are a crisis, but they can be a little bit different, so you also have to prepare your staff. We have our staff trained in psychological first aid. And there are some other individuals that are trained in critical incident stress management as well. The type of support that we offer or that we make available, of course, to ourselves if we experience a disaster, but we also make ourselves available to our sister local mental health authorities. It is I think something that I've learned from my past. We were part of the Sutherland Springs mass shooting that occurred in 2017. When you are impacted as a local mental health authority, it is a very heavy burden to carry. So I am not ashamed to ask for help. We needed help. We did have a responsibility to respond. We will respond. But it is also, I think, so important when we can rely on our other local mental health authorities to help us out. Hill Country did help us out in that situation as well. Camino Real, in this particular, devastation, deployed a group of 10 people, 5 licensed professional counselors, and 5 qualified mental health professionals. Todd mentioned that there are other local mental health authorities that stepped in very quickly as well. We jumped on a Zoom call, had a plan probably within an hour as to what the 5-week rotation was going to be, and it did consist of a 10-day stay. So we did have staff here for 10 days to be able to offer the support to Hill Country. This, of course, has just been a very sad situation. I reached out probably within 1 day and offered Camino Real services to Todd and Landon. just saying that we were ready to support in any way that we could. So I was very honored to be able to do that. The type of support we did offer, our group has already come and they're back home now with us. But they offer very basic on-the-ground support. It consists of community outreach. You go knocking on doors. You go make yourself available, visible. I think the green shirts, we ordered our green shirts. We had the vest available. We made ourselves very, visible. At first, you will not do something referred to as clinical services. You are simply offering support. It could be as simple as handing someone a bottle of water or just giving them a hug because that's what they needed. It's going out to those homes and just making sure you say, do you need my help? Do you need anything? Our staff were, gracious to be able to take a wagon and walk to be able to deliver water and food to individuals. And that's the basic emotional support that you make available. It's not carrying out a therapy session necessarily. That will come later. Emotional support comes in many forms, as mentioned. It is also offered in the form of working with someone who may just not know the steps you need to take to get to FEMA. How do you get help? So being able to refer them for those services that were available. In our case, and I think in most mental health authorities, you have to have the ability to rapidly deploy a team. You need to be able to go out to shelters. You need to be able to go out to the schools when schools are open. You need to be able to go out to any local church events, go out to where the people are. You go to those impacted neighborhoods. Again, distribution of water, food, hygiene kits, comfort items to build trust, and then just to offer that opportunity for an open dialogue is always very important and very helpful. Non-clinical engagement, as I mentioned, people aren't always ready, nor do they ask for that clinic. I'm a therapist. I'm a licensed professional counselor. Sometimes it's just sitting and listening. It's not therapy. It is not. It's not going to happen this soon. I think there's a lot of shock initially, and the stages of grief are setting in, that experience of just loss in general, loss of home, loss of life, just loss of your whole community and your what was so safe to you. Follow-up outreach will, I think, be ongoing. It's important to be able to continue contact if people do want to come later for help. I think also making sure that you're you mentioned first responders. I saw firsthand from our experience with Sutherland Springs the devastating impact it had on persons that had to, and it happens here, I'm sure it happened in Uvalde. What happens to the individuals that are responding, what happens to the volunteers, and sometimes that discomfort with realizing that you need help. So whatever we can do and whatever I think can be done around that area is going to be a very important discussion to occur. You have to plan for the long-term mental health needs. I said earlier that sometimes that non-clinical engagement is what you need up front. But the aftermath of all of this, the aftermath of disaster in general, of mass shootings, of whatever the situation, will result in long-term mental health needs. And I think that's where, we are ready to serve our Camino Real Community Services. We are spread out over 9 counties in our area. You have many more counties to serve. But, as a group, recognize the lasting mental health impact, recognize the impact on first responders, prepare for increased outpatient treatment needs post-trauma. We are still in the initial stages. It will follow, and there will be long-term needs that must be addressed. I think many people do get through situations like this, but then there is always going to have to be that education, the outreach, and I think making ourselves available to say there is probably going to be some people that have greater needs and that will need that psychiatric intervention and that will need the therapy and will need medications. That will happen. It happened in Sutherland Springs. We went through phases, and then our numbers doubled. Our outpatient mental health numbers doubled. The children's numbers have gone, they're just out of control even at this point, and they have just kept going. We did a really great job of outreach, and I think that's what the benefit is of knocking on doors and having your emotional support office open and welcoming. So I guess building a sustainable capacity for long-term community support by investing in long-term treatment.
Okay, and we offer some recommendations, and I do want to talk a little with you about the Uvalde response. Some of you were here during the 88th. There was legislation and funding, and there was a focus on an expansion in crisis services and in outpatient services, and we kind of see this as similar. In the aftermath of the tragedy, we deployed the same sort of system. We were there the next day after the shooting. We operate a clinic in Uvalde that sits 2 blocks from Robb Elementary School. We had staff who could hear the shooting. And the governor, immediately, and legislative leaders ordered a budget execution order, one of which, from what I remember, there was an emergency session. And they ordered us as the local mental health authority to have a needs assessment conducted of the Uvalde region. And we brought in Meadows Mental Health Policy Institute, and Meadows did a very extensive review. Results were presented back to the legislature through HHSC, and there was focus on crisis service and outpatient expansion in the aftermath of that tragedy. And at that time, you made an investment in Uvalde to the tune of $30 million for a behavioral health care campus to be constructed, and dirt is moving now 2 miles from downtown Uvalde, which includes a 16-bed adult crisis unit and a 16-bed kids unit and an integrated outpatient center. It's 50,000 square feet. It'll sit about 2 miles from downtown Uvalde. The 88th legislature funded that. The 89th funded the operational funding for the facility. So it's about $10 million a year to run the 2 16-bed units. So one of the recommendations is an expansion around crisis residential capacity funding for operations. That was a critical component of what came out of Uvalde. Also, there was a focus in that Meadows needs assessment, as Veronica had acknowledged, our service counts jumped dramatically after the tragedy. And we are seeing folks, now this is 3 years after the shooting, folks coming in with very severe mental illnesses. And we have contract therapists who have specializations in trauma therapies. And some we bring in from San Angelo, some from San Antonio. We put them up in hotels for a couple of days so they can serve our clients because they don't live in Uvalde. And so, again, as a byproduct of that tragedy, which was a mass casualty event, and a focus on an expansion in crisis services and an outpatient expansion, we think that something like that should be looked at. One of the recommendations of the Meadows Needs Assessment was youth crisis outreach teams. You all just made a significant investment at the 89th legislative session to fund, which I'm sure will be under competitive solicitation shortly, for that there be more youth crisis outreach teams throughout the state of Texas. So those are two recommendations to you all. You want to cover the final two?
We've got one question for you.
Mr. Lauterbach.
Thank you, Director Sanchez and Chief Citron. Thank you for providing, coming together to provide a critical need for this area. But let me clarify some things now. The local LMHA, part of the 39 in the state, that's MHDD?
Yes, sir.
Okay, and Camino Real is where? Are you a contractor?
No, we are also a local.
So you just work with the LMHA?
We are helping out. We offer to supportive health. We are a local mental health authority. We neighbor.
You are part of the 39 in the state?
Yes, we are one of the 39.
Okay.
Just like
and y'all also
Hill Country.
came together with 5 other centers here in the state?
Correct.
Yeah. So the combination of services to provide the manpower here to service the Hill Country?
That's correct, yes. It was a total of 6 local mental health authorities, including ourselves.
Okay, well, that's good. I appreciate that. Thank you.
Yes, sir. Thank you.
Senator Kokhorst.
Yeah, thank you all so much for staying tonight. Your recommendations, I really appreciate it. The YCOT funding that we've put out there and we've built over the last 2 sessions, very good. The Uvalde Crisis Center, I know Uvalde is only 68 miles from here. I think certainly it could be utilized with this tragedy as we have that built out. And that is part of the, you look at the size of Uvalde and part of the, wrestling of, is it big enough and can we get the workforce to be able to fulfill the needs in that area? What's your answer really quickly on workforce?
Yeah, so in regards to workforce, one of the recommendations out of Meadows was a partnership with the local junior college out there. We have created a behavioral health certification program. These will be the technicians that work in the 2 crisis units, and I believe they've already graduated 2 cohort classes out of that.
Great, super. Lastly, I want to say that this disaster is slightly different than we talked about this in the back of the room with the mom from Houston. So because of the tourism aspect of the Guadalupe and Kerr County, the camps, so when this disaster hit, there are a lot of people that have now their tragedies they've taken back, whether it's to Harris County or to Austin County tomorrow, as I will be attending visitation for one of the campers from Mystic to be with her parents and to give our condolences. And so this crisis, as my staff and I have discussed, is different because it's impacted so many parts of the state. So as we move through this, Mr. Chairman, we'll be looking at how we get those services out. I specifically asked Health and Human Services, shout out to Brent, who has been here for now we're going on 13 hours the whole time. We're going to come out with, by next week, we're going to have dishes in Health and Human Services, create a specific outreach to the campers and their families that were here from the testimony we heard here today. So we're going to take some action. So it doesn't all fall on the LMHA here because it's so widespread, again, with the visitors that were here on 4th of July. So thank y'all for your recommendations. Look forward to working with y'all. Look forward to getting the Uvalde it's not necessarily a mental health hospital. It's a little bit different with the 16 youth beds and the 16 adult beds. I think I got my numbers right there, combined 32. But I think that will be utilized from this for our local residents as well.
Yeah, thank you, Senator Cokhorst.
Mr. Darby.
Thank you, panel, and thank you for your testimony. I know it's late and we're all looking to go someplace else, but I got a quick question here. And I want to ask if you're working alongside our federally qualified health centers, FQHCs, La Esperanza Clinic in San Angelo and Junction, and Frontera Healthcare Network in Menard, one of your counties. So I guess the question is, are you working alongside these entities or in this arena for the long-term care of behavioral health care of individuals? And if not, why?
Yes, sir. We are. As a matter of fact, Judge Corbin was here earlier from Menard County, and he mentioned about an event up there, and there were counselors were deployed. Some of those were our counselors. We brought that mobile vehicle I mentioned to you. I worked very closely with Mickey Hand from Frontera. We coordinated that together. So yeah, we work closely with the FQHCs. Back in Uvalde, we worked very closely with CHDI down there as well. As a matter of fact, part of a goal of ours is to be able to integrate behavioral health clinicians into their primary care clinics. We do that in Uvalde, and Mickey and I have already had discussions about that.
Tom, it's just a personal thing with me. It's not Uvalde, it's Uvalde.
Uvalde, yes, sir.
Okay?
Yes, sir.
Okay, thanks. I know it's late.
I don't have any.
I think you guys survived. We really do
Thank you
appreciate
very
what you
much.
do and appreciate you hung in there. And, we got a tall order ahead of us, but we'll get through it.